Wednesday marks World Asthma Day, and this year's theme is Uncovering Asthma Misconceptions. The World Health Organization estimates that over 339 million people had asthma, with over 417,000 deaths in 2016. In sub-Saharan Africa, it's estimated that over 50 million children under 15 years suffer from the disease, and most victims are from South Africa. Dr. Lethabo Machaba is a paediatrician at Netcare Sunninghill in Johannesburg, and she joins us now to discuss this. A very good afternoon to you, Doctor, and thank you so much for your time. So the theme is Uncovering Asthma Misconceptions. What is one of the biggest misconceptions about this?
One of the misconceptions that we see mainly from our population is not understanding the disease itself. Working at private and government, I've been in both. When I started off, when I was doing my registrarship to specialize as a pediatrician, I was based at Baragwanath. And there we used to get a lot of admissions of cases of asthma that would actually end up going to our ICU. And it was very sad to see how we could actually lose some of them. Having moved from government and now working in private, I was also a bit discouraged to see that even in the private setting where you're working with a more educated population, we still get a lot of asthma cases coming at the severe end. So the misconception out there that I feel is a big problem is that people are not willing to accept, first of all, the diagnosis of asthma. And number two, when it comes to management, they don't even know how to control the disease, which is why it's very, very important that considering the fact that the month of May is World Asthma Month, with the 5th of May being the World Asthma Day, that we need to actually educate the public in terms of how to treat asthma, accept the diagnosis, not as a death sentence, but as something that you can actually live with the disease. It's a chronic disease, but we're able to control it.
Doctor, asthma, and I probably shouldn't be saying this, but, I say it because it's something that I've come to understand how big it is of a disease. As a child, and luckily I managed to get over it. Is it something that you can actually get over? Is it something that can stay with you for the rest of your life? I know it is something that can be fatal, but is it something that can be kicked?
So asthma is a chronic disease, and by the virtue of saying that, it means that it's something that stays within the body. But the good news as pediatrician is we do see childhood asthma if we get to treat it early by using the type of maintenance that we use. We've got maintenance pumps that we give to the public, which actually helps to control the disease. Then we've got what we call SABA, which is short-acting beta agonists that we actually give to our children. By them learning to maintain it using the maintenance pump, they are able to not use that SABA as often as they need to use it. And we have seen as they grow older, most of them even outgrow it. And as they become adults, some do still continue to get the asthma as a disease, but we have seen some children who control it so much that they don't even show the symptoms once they're adults. But for me as a pediatrician, I really, really do emphasize to my parents, like how you are a successful story that you had it as a child and now you're fine. So I always encourage them that, come on, we can do this. If we can just learn to understand the disease, use the medication appropriately, then it can be something that they can outgrow as children, which I personally have seen successfully in my own practice.
So then you're dealing with a child who's of the age where they can understand when they are being teased and all sorts of things. And I myself it didn't happen to me, but I know it had happened to a number of kids where asthma is seen as though, childish. Like, why do you have asthma? What are you doing with asthma? It's like, what are you doing with lactose intolerance? How are you dealing with such a thing? How then do you teach a child? This is a serious thing, and it needs to be dealt with. And don't be worrying about what other kids are saying.
So for us, putting in positive input into a child and positive energy is very important. So what we mainly used to do is, what we do in our practices is, remember, when we work with a child, there's always an adult who is actually supervising and actually is a guardian towards the child. So, for example, if we're dealing with a 1-year-old child, you might not be able to educate them concerning the asthma, but we can go through the parents. Once you have an older child who's going to school and experiencing bullying like what you are describing, then we can then also talk to the child. And the most exciting thing is with now, we are moving into a digital age, and which is why I'm so excited by this campaign that AstraZeneca is running. They have now digital things that we can use to empower our teenagers. And for me, I know a lot of health practitioners, even parents, are not even aware of this. But there's things like Rate Your Reliance Test, which children can go on media now. They can use their cell phones, they can use their laptops to go and just learn more about the disease, also focusing on the website, the Yes to Breathe website. So the only thing that we can actually use to empower our children is knowledge, so that even when they face a bully at school, they themselves are empowered to actually answer back and to say, yes, I've got asthma, so what? What are you going to do about it? Do you even know what asthma is about? You know, so if we give them positive energy and the knowledge, then they can use that to fight back and not actually allow themselves to be victimized.
Doctor, thank you so much for your time this afternoon. That is Dr. Lethabo Machaba, a pediatrician at Netcare Sunninghill. Here's what's still to come here.